Hello viewers, I am Dr. Abhijit Agashe, Chief Joint Replacement Surgeon and Robotic Surgeon at Baner Manipal Hospital. Today we are going to discuss about hip arthritis and the treatment modalities. Why does hip arthritis occur is the primary reason in our country is avascular necrosis, or also called as AVN. Nowadays we are seeing a lot of patients of AVN mainly because of a complication of the disease that was there a few years back called as COVID. What happens is, due to COVID, the blood becomes a bit thick and the blood supply to your head of the femur or the hip joint is destroyed, and thereby leading to arthritis. What are the other causes? The commonest second cause is rheumatoid arthritis. The third cause is post-traumatic. That means you have sustained some fracture around the hip, which eventually leads to an arthritic hip and pain. The other reason is overdose of steroid, or maybe at times overdose of alcohol. So these are the reasons of getting arthritis. So what was the previous treatment available? Yes, we used to get this disease very often even before COVID, but after COVID the numbers have gone up very high. Not only that, what we are seeing is the disease is much more aggressive compared to what we used to see pre-COVID era, and the disease progresses very fast, leading to a lot of pain and disability to the patient. Thanks to the availability of new technologies like robotic surgeries and also the new understanding by the doctors, there is a new concept called as robotic-assisted direct anterior hip replacement, which helps you to go back to your normal activities. Just in short, how does robotic help in this? First and foremost important, it helps you to put your hip into the precise position that it has to be according to the nature. Second, it also gives you a chance of seeing whether your hip is performing well pre-operatively before you actually put your hip in. So the first advantage is putting it in the right position. Second is you can get your leg length absolutely bang normal, and if it is assisted with a direct anterior approach, yes, you can go back on the floor, sit down on the floor in cross-legged position, or even go back in squatting position as our Indian style or our Indian people are used to. So if you have any queries regarding your hip arthritis or wish to know more about direct anterior hip replacement and robotic assisted surgeries, please do contact us. Thank you.